I consider a few things. One is medical therapy, and there's medications like Propecia, generic is finasteride, and Rogaine. And then there are less invasive ways to restore hair growth, and that'd be PRP, which is platelet-rich plasma. We'll talk about that. And the third is hair transplantation, where we get follicles from the back of the head and plant them in areas where you're thinning. And there are indications probably for all three of these ways, and sometimes we even combine them. When someone comes in for hair restoration, the first thing I'll ask is if they've been taking any medications like Propecia or Rogaine, and if it's been effective. Secondly, we like to assess the rapidity of the hair loss and see if there's any link to genetic predisposition, where we can basically estimate the degree of hair loss down the road. And once we determine these things, we'll try to figure out what the desires are, and hopefully they're realistic, and we can plan a program, perhaps using hair transplantation with PRP or without PRP, and medications to restore your hair. But everyone's different, and depending on the age, the rapidity of the hair loss, and those kinds of factors, will really determine what's the best course. There are some limitations with hair transplantation. It works best when there's some areas thinning. When we have really advanced hair loss, it's generally impossible to restore a full head of hair. We have limited resources back here, and so we can only use so many follicles to restore your hair. So it's important to understand what we can accomplish before we go down that path. Hair transplantation is generally done in a few different fashions. There's the extraction process, and that's where the follicles are removed, generally from the back of the head. That can be done in a strip method, in which a surgeon will make an incision in the back of the scalp and take out some tissue, and those follicles will be chopped up and then separated, segregated, and placed into the scalp. That leaves a scar in the back of the head that many men or women find unpleasant and visible, particularly when they're in the water and getting out of the water or a shower or that sort of thing, or even if they wear their hair short. It could be a problem. To avoid the linear scar, we could use manual extraction, FUE, and that stands for follicular unit extraction. It's done by removing each follicle one by one, either with a little instrument, like picture like a little hollowed out screwdriver of some nature, or something like Neograft, which is automated, and that uses a little punch and gently extracts the follicle from the scalp with a gentle suction. These are two of the more common ways to extract hairs. There's a third, which is ARTAS, A-R-T-A-S, and that's robotic extraction. They all have their advantages and disadvantages. I tend to believe that Neograft provides the most gentle extraction method and thus the best viability of the grafts, which of course is very important, because if we're putting in follicles that don't live, you don't grow hair. When we perform FUE, or follicular unit extraction, we will extract basically every third or fourth follicle in the back of the scalp in this region here. And the punches we use are very small, sometimes 0.8 millimeters, sometimes 1 or a little greater than 1, but these are very small punches that leave very little scars that are often imperceivable or not visible. It'd be very rare to have visible scars from Neograft using these small punches. When we extract back here, the density reduction isn't going to look thin as opposed to the hair up here. And the idea, of course, is to thicken any of the areas that are thinning in the crown or the temporal region, not necessarily to give you the same density as you had 10, 15, 20 years ago, but to get it to a density where it looks good and natural. Hair transplantations is an all-day affair. So we're talking about a patient arriving at 8 a.m., getting marked, shaved, injected, extraction and placement of the follicles one by one can take an entire day. You're there maybe at 5 or 6 o'clock for a really large session. The recovery time for hair transplantation depends mainly on the extraction method. The implantation is generally the same. If the extraction method includes a large incision in the back of the scalp, the recovery times will be longer, let's say, than doing the FUE method where follicles are taken out one at a time. We're looking at maybe a couple weeks recovery of staples coming out and healing with the linear strip method versus a very quick recovery. Perhaps these donor sites, as we call them, will heal in a few days. The implantation is the same for both methods because we're talking about extraction methods and implantation. The follicles that are placed will leave little scabs that will exist maybe up to 5 to 10 days, and then they'll naturally be washed away with bathing. And the stigma or the evidence, so to speak, that a hair transplantation was performed should be gone by 7 to 10 days, sometimes earlier. And if we're grafting areas that have already pre-existing hair, they can camouflage the recipient site, then people can go back to work in a few days. It's important to understand that the results of the hair transplantation are not really dependent on the extraction method that we talked about, but it's actually implantation. And that's where more of the art comes into play. After the follicles are extracted, we will segregate the follicles into the ones that have 1 hair, 2 hair, 3 hair, or 4 hairs. That is, some of your follicles may have multiple hairs. Then we'll place the follicles in an orientation similar to the existing hairs in that area. So we'll be able to, under magnification, find the orientation as it comes out of the scalp. Usually it's not perpendicular, usually it's in an angle, and that angle will depend on the different area of the scalp. So we'll place them in the appropriate orientation and also in the appropriate density pattern, meaning that the follicles that have 1 or 2 hairs are generally placed in the front. That's how our hair naturally grows. And the 3s and 4s are placed further back and into the areas where we blend, which leads to another point, which is blending. And this is a critical part of a hair transplantation because if a man comes in with a moderate hair loss pattern, it's conceivable that he may thin in the future, and we don't want an obvious step off between grafted hair and the native hair. So it's important to graft that area that can thin out potentially. The hair that will grow from the transplantation can take up to a year to grow. The follicles will be placed into the scalp and it can go through different phases and probably end up in a sleep state for a prolonged period of time. And before they wake up, that could be, again, months to up to a year. And they will all wake up and grow at different rates. And then by a year or so, they should be more in sync and grow consistently.